All right, good morning, Labor, Health, and Social Services Committee. Welcome to February 19th, popularly known as President's Day, which I think the federal government celebrates, but we still work. Is it a state holiday too? Oh. So thank you. All the state employees in the audience are nodding yes, it's a state holiday. So we appreciate you being here on your free day as well. We were in the middle of discussing House Bill 44 and had the Wyoming Medical Society in front of us. Welcome back, Mrs. Bush. I see you've brought a good doctor with you. I don't know if you had additional comments or we were currently throwing questions at you, but I think over the weekend, perhaps you might have some introductory remarks. And if you'd introduce who's with you today, we'll continue.
Oh, yes.
I suppose we should probably call the roll.
Way to go. Good catch.
Let's start there on a Monday morning.
All right. Representative Chadwick.
Here.
Representative Clouston.
Here.
Representative Hornock.
Here.
Representative O'Hearn.
Here.
Representative Penn. She was here, but she's next door. Representative Trujillo.
Here.
Representative Ward.
Here.
Representative Yin.
Here.
Chairman Zwanitzer.
Here.
Thank you.
Thank you. And thank you, Representative Hornock. I'm just so excited to be here this morning, as we all are. For posterity, a second reading of the budget with a lot of budget reading amendments ahead and a long day. So I'm already preparing in my head. Back to House Bill 44, Parental Rights and Minor Child's Health Care. Welcome back, Ms. Bush. Any introductory comments over the weekend?
Thank you, Mr. Chairman. Again, Sheila Bush with the State Medical Society. I don't have a ton of introductory remarks other than kind of, underscoring what we talked about last week. I did feel like I was asked a couple of questions that I maybe wasn't prepared enough to give appropriate responses to. I'm not a physician. As I like to tell you guys pretty frequently, I have a degree in piano performance. And so when I get out over my skis, I call for help. And so this morning I have Dr. Andy Rose. He's a practicing pediatrician here in Cheyenne and can answer some of those more in-depth questions that were asked.
Welcome back, Dr. Rose. You were with us last year in 2023 on some bills as well. I'm sure you've read over this. Any comments you have to offer before we ask some questions?
Sure, thank you, Chairman. So I'm Andy Rose. I'm a pediatrician practicing at the Cheyenne Children's Clinic. And after reviewing the video from the meeting last week, I just wanted to try to clarify a couple of things if it's possible, and then I'll certainly be open for questions. I don't believe that the intent, just right off the bat, I guess, hitting home, the intent of one of the bill changes to remove and I guess improve parent rights. I want to just say that in terms of minors and their medical records, I don't see this bill doing that, only because parents have access to medical records through a number of different ways. And if possibly, it sounds like maybe the hang up was with a online portal system. This law really doesn't deal with that in terms of access to records. So, but what it does do is it does limit access to care, which is what Sheila brought up last week. And especially in ways that seem to me to be not effective. Primarily, we can talk about the section that discusses tobacco cessation, and minors who are using tobacco typically aren't sharing that with their parents, and to then be able to, or to then make it harder for them to want to talk with me as their pediatrician who could help them, could direct them in the right ways, and then not be able to do that in confidence with them. There's actually really good data that shows kids will be much less likely to look for that care. So it limits access there for children wanting to get help. And then the other section, I think in emergency situations, there are just a lot of things that, and a lot of moving parts that, again, I would be open for questions, but if for instance, I think one thing that came up, right, was an example of a time when emergency care would be needed for minors when parents couldn't give consent. And, unfortunately, I think you guys actually did come up with a few good examples. The Ebola type of, unfortunately, Ebola, Marburg virus, and many others have been sort of cited as possibilities for bioterrorism. And unfortunately, in our world today, I don't think, especially after the COVID pandemic, that is so far-fetched of an idea that could possibly happen. And one of the only ways proven in pandemic and epidemic responses and bioterrorism response sort of planning is to rapidly vaccinate all exposed people. There's basically instances where doing a rapid containment of one of those vaccine preventable diseases could really stop that outbreak from starting at its source. And so to limit that and to have it so that just we here in Wyoming couldn't be able to use that option seems a little unreasonable, especially with how close we are to a military base. So, but I'll be open for questions.
Okay. Cool questions for Dr. Rose. Representative Ward?
Thank you, Mr. Chairman. Dr. Rose, I was told by other medical professionals, particularly in Casper, that this was one of the reasons that parents could not access their 12-year-olds' online medical health records. So what you're saying about it not having to do with access to medical records is something different than was told to me by some other medical professionals. I'm wondering if you can expand on that.
Sure, Dr. Rose, if you know.
Well, yeah, Chairman and Representative, the instance they were discussing, I don't know details of, but the law as it states does not limit that parent access for all other things except for if that child was using tobacco and they were in that visit with that as a sort of one of the diagnoses, then yes, that parent would be limited and not be able to see that note. But I don't, and that, there are a few other cases. So I don't know this, again, I don't know this instance, but could this person have had, could there be either physical abuse, sexual abuse? There's a lot of other reasons why possibly a parent is unable to see a child's chart, and it's usually for safety of that child. And in this case, it's so that that child, that adolescent, can get care that's appropriate for them and to do it in a way that they will be, again, more likely to actually seek it out and not fear that retribution, I think is the word, a retribution from their parents.
Follow-up, Representative Ward.
Yes, do you recommend COVID shots for children?
Dr. Rose?
Yes, I do. They've been proven to be very effective and safe. So, we in our practice offer them. It's not something that is ever forced upon anybody, but we know it is a part of, again, pandemic response that has shown to be effective.
Representative Ward, third time.
Thank you, Mr. Chairman. Dr. Rose, you are aware of the correlation of myocarditis with those shots, right?
Getting a little in the weeds, but Dr. Rose, if you are, let us know.
Chairman, we are aware, and that it has been well documented in terms of, again, safety. And if we need to go into the data, we could do that. There's a lot of misinformation that is out there about, not just COVID, but vaccines in general. And so I just stand by that vaccinations, including COVID vaccination for children, is a safe option, and it happens. And it's what helped stop the pandemic.
Representative Hornock, question?
So in your testimony, you gave some broad examples, emergency situations. Have you personally run into a situation where there has been an emergency that that this would apply to, where you've dealt with this in your practice? Has there been a specific instance that you've had?
Dr. Rose,
Chairman,
broadly.
Yeah, Chairman and Representative, I work in a outpatient practice primarily, and I do cover the hospital sometimes. But no, there has not been an instance where I, not working in an emergency room, have had to luckily, where I have not been able to get a hold of a family, and I'm assuming you're talking about this section of the bill where getting a hold of a family in an emergency situation, right? Not the nicotine part. So there's not been an instance where I've had to do that. I've definitely had discussions with adolescents about nicotine cessation. That happens a lot. But in terms of emergency situations, I think what we're dealing with is the 9/11 type of response when, heaven forbid, there's a, mass casualty or some other bioterrorism kind of event. And what is needed is similar to what happens with a rabies exposure. Rapid rabies vaccine is given when someone has a exposure to rabies. And if that is delayed, there can be, very bad consequences. There was a death from rabies here in the state of Wyoming just back in 2015. And those are the kind of viruses that we're talking about as very rapidly and, very lethal, but also potentially rapidly spread viruses if they're put into that bioterrorism kind of a pathway, or if, heaven forbid, again, something like that would happen. But no, I do not have any specific examples that I could share in my own practice, no.
Okay, other questions for the Medical Society? Representative Clouston.
Thank you, Mr. Chairman. So, Doctor, thanks for being here. Some great testimony. I appreciated it. The only part of this, I guess, I'm really disagreeing, or I need some more information with you, is if you can just give me some more examples on the smoking cessation. I guess as a parent, if my child is going through some destructive habits, I feel like our most successful outcome would be me working with my child, and I have a right to work with them. And maybe this bill isn't written the way that for what I'm looking for, but I just need to know from you that you feel like this smoking cessation program is effective and it's better not having the parents involved.
Dr. Rose.
Chairman and Representative, thank you for that question. I totally agree with you in that most cases, parents would be the way to go. I would love it if that were, in a perfect world, every parent has a great relationship with their child, can speak with their adolescent, have the rapport and the ability to help them make good decisions. But unfortunately, that's just not the world we live in. There are unfortunately cases, like I mentioned, cases where there's abuse going on, there's something else where the children fear that sort of retribution. And I think in a lot of our homes, we would want to have that open kind of conversation, but a lot of homes, that kind of open conversation is not welcome. And if children were to try to go that route, I think, again, it's data has definitely shown adolescents in general, even potentially, in households where there isn't obvious abuse and things like that, but there's just that fear, and adolescents will not undergo treatment or seek out treatment if they fear any kind of, getting in trouble. Most of the time they're doing this without our knowledge, right? And I think they're going to continue doing that. They're more likely to continue and not get help just because they don't want it to come to light.
Thank you, Mr. Chairman. Are you obligated to report incidences where you suspect child abuse?
Yeah, Chairman and Representative, yes, we are.
Other questions for the Medical Society? Ms. Bush, one more.
I was just going to offer, in looking at the language, it feels as though, in direct response to Representative Clouston, one fix that you could contemplate that would leave the pandemic response language intact and potentially get to a halfway point or a compromise would be to leave the tobacco cessation language as it is and then add a sentence that clarifies, because there does seem to be some disagreement. Representative Ward was told one thing here in Cheyenne, and what we understand about our system, it's different. And so you could add a clarifying sentence that just says, a parent has the right to see the record. So you could leave that component about not requiring consent in place, which I think addresses, a situation of a youth seeking help. But if a parent really wanted to make sure that we had access to that record, and if any parent could call the hospital or get that record and say, you know, what treatment has my child received, you might have an opportunity for some middle ground there. It's the position of the medical society that the bill shouldn't move forward at all. We think that, you know, if there is something that's truly concerning in terms of access to medical records, we could work together and get there a different way that might not roll back some really important public health safety measures and things that live in statute, or inhibit a youth from getting the care that they need. I would offer one other thing in response to Representative Hornock seeking a very specific example here in our state. It's my understanding that in 2002, when the Transportation Committee contemplated overhauling our public health statutes, they looked across the country for best practices. And so they took all of the language from different states and what they thought really was the best. And so what you likely have in front of you comes also from states that have significant and frequent natural disasters that lead to public health emergencies. We're very blessed in this state. We don't have a lot of that. I think our biggest threat is maybe Yellowstone erupting at some point. We don't have hurricanes. We have very few tornadoes. But I think that having that in place and leaving that language intact is a good idea. It has been established as best practice. It's across the country as sort of, you know, the things that you do in a mass casualty or a significant natural disaster. So hurricanes, tornadoes, a volcano, who knows? And so that's why that language is there. I think we can't give you a specific example here with our providers in Wyoming because we just haven't had those events here. We haven't had a Katrina. And so that's why we can't give you a specific example, but why the language is really good language and should remain in place.
Do you know if any state's taken out that language in the last 20 years? I don't know in your research if you've seen any updates. I think everyone did something similar in about 3 years after 9/11 and
yeah.
Anything?
Mr. Chairman, no, I don't know of any states who have removed this language. I do know over the weekend I did some research on the nicotine cessation piece, and our neighbor to the west, Utah, is actually strengthening their language for the nicotine component of this bill. They have language similar to ours in statute, and they're actually adding a lot more language to make it even easier for youth to access nicotine cessation therapies and the like. So in terms of when we do state comparisons, some love to do it, some don't like it as much. But Utah in many ways is similar to us in a lot of their, I guess, political leanings, and they are strengthening their language.
Thank you, Mr. Chairman. This question is for Dr. Rose, and it escaped my mind. I'm sorry, Mr. Chairman, come back to me in a moment.
No problem. I bet they'll be around a bit if we need to call them back up. Anyone else? Seeing none? Thank you much. Ms. Bush and Dr. Rose.
I'm sorry.
Nope. All right, sit on back down.
Thank you, Mr. Chairman. Please forgive me. Dr. Rose, when you do treat minors for tobacco cessation, who pays the bill? Because if it's hidden from the parents, how can they pay the bill?
Dr. Rose.
No, that's a great point. Very good point. So parents will still get a bill, you know, and I think that's potentially where a sticking point comes up. But and it's not that, you know, you want to keep the secret forever, but I think getting that original access and being able to tell an adolescent that I'm going to keep this in confidence. We can talk about this problem. I know you have been vaping, and vape pens are incredibly easy to hide from parents. I'll just tell you right now, that's something that these kids are unfortunately doing at high rates. But you're right, they're going to get a bill. Parents, if parents, they're the ones getting the bill. So eventually that is something that probably comes to light. But as long as we don't access that initial entrance into care, we're able to provide it and hopefully help them on the path towards cessation. Maybe their parents do find out. And what I try to do is I try to have that conversation. Okay, you're getting help now. We're going to bring your parents in and we're going to talk about this together. And we're going to see if we can't come, you know, it's sure a lot easier to have that conversation when I'm in the room potentially and make it so that this is not just about one child hiding something, an adolescent child hiding something from their parent, but we're all working on this together to help this kiddo get over this nicotine addiction.
Thank you, Mr. Chairman. So I was told previously that the parents don't get the bill because HIPAA would prevent that from happening. They're not allowed to know about the fact that their kids are getting this treatment. They wouldn't get a bill.
Dr. Rose, do you have, adolescents come in specifically to talk to you, or is this usually something as part of a routine medical exam, a physical, and then so it might not be documented the same way you just bill it for a physical instead of billing it for prescribing a certain type of gum?
Yeah, Chairman, good point. And thanks for the question, Representative Ward. The ins and outs of the billing, that process of billing would be different in my practice versus, say, my psychiatrist at my clinic who does more, protected mental health and probably a lot more substance use sort of counseling and things like that. So what Chairman Swanitzer said is very true. I will see kiddos for their sport physical or for their wellness visit, and certainly there's still a bill that goes in for that. But there, honestly, a lot of times, if they typically don't come in just for that reason, right? They're going to come in and say they have headaches. They're going to come in and say something else. So it also could be that we, the overall charge is dropped in a different way, and it doesn't necessarily have to be linked to that smoking cessation thing. So you're right. There are ways that I think can be probably done, but we don't try to necessarily hide it from parents.
Mr. Chairman, I think we're maybe mixing up a couple of different things. Wyoming also has the Quit Tobacco, or the Quit line, and that is free of charge. That's in part, and I think the Department of Health is here and they can clear up all of the wrong things we've probably said, but I think we're talking about different things. And so you may have been told something that was in light of the Quit line. And so I know there's data available. I spoke with Representative Trujillo about some of that data and how many kids have accessed that Quit line or received counseling, those kinds of things. That's free of charge. So there is no bill to be had. So I think someone needs to come up probably from the Department of Health and clarify that there's different pathways, and healthcare is really complicated. And so, thanks. If I say it enough time, they'll just come sit next to me. So I think that there's the private clinic, there's the Dr. Rose example, the way his clinic works. Then you have the public availability of some of these resources, and that works a little different. And so with that, I'll just give it to Stephanie.
Hi, Ms. Pyle.
Good morning.
Introduce yourself, please.
Good morning, everyone. Stephanie Pyle. I'm the Senior Administrator of the Public Health Division at the Wyoming Department of Health. And I'm happy to provide some clarification about the youth program that we have available through our Quit line. We do have 197 kids who have taken part in that program since it started in 2019. What I will clarify is that through that line, kids are not given any nicotine replacement therapy, nor are they given any medication. It is simply coaching. And so I'm not sure if that's where there's some confusion, but so that line is free to both youth and adults, but there would be no charge that would come as a result of a child reaching out to that line. And that 197, we don't have data on whether there was parental consent or knowledge on those, but we do have those figures that I wanted to offer. So with that, I'm happy to answer any further questions.
Do you require them to give you their name, or can they give a fake name, or do they have to give any personal identifying information to you to access the coaching in the Quit line?
Mr. Chairman, for that level of detail, I'd like to ask another individual from my team to come up to provide that response, if you don't mind. So I'll have Rachel Nuss come up. She's here. Ta-da!
Morning, Rachel. Go ahead. And if you'd introduce yourself to the committee as well.
Yes, good morning. I'm Rachel Nuss, and I'm the Community Prevention Unit Manager at the Wyoming Department of Health. And, I'm answering, Chairman, I'll answer that question. Yeah, so we have a Taylor automated texting program for youth And it's a simplified registration process, so we aren't doing any confirmation necessarily of who that individual is. They're just able to kind of participate in the program.
Other questions for Public Health? Representative Hornock.
Chairman, so deleting this section of language, does it change anything about the tobacco cessation program? That it's my understanding that that program will continue just as it is, just as it always has been. Is that correct?
Ms. Nuss.
Chairman, Representative, we have talked with the vendor and they are able to accommodate requesting confirmation from the parents, but it would change the intake process. They would have to call in. Right now they can text in or sign up online, and that would no longer be something that they could do. So.
But there would still be just as robust a program within the department for tobacco cessation, correct?
Ms. Nuss?
Yes, Chairman, Representative, yes, the program would still continue in its existence.
Other questions for Public Health? While you're here, I might have a couple. So in the scenario of a disaster response, and I assume you're the right people to ask, we do a lot of planning exercises should a mass casualty or harm event occur. Do we have a mass vaccination treatment kind of plan in place should we get hit with a chemical agent? And there is kind of a systematic response of what we do, how quickly in the event of an emergency. Can you, I know that's very in-depth, but kind of vis-a-vis this bill, cursory, give us how that would work.
Mr. Chairman, we do in fact have several disaster and preparedness plans. Those really came about, long before my time in light of the 9/11 attacks. And so as a result of, what we faced as a country at that time, states and localities do have different levels of preparedness planning in place. So we do have a number of those plans, and if there's anything specific the committee would like, I'd be happy to follow up with that information. But we do routinely work on those plans. We update those plans. Certainly we've used what happened during the pandemic to make those plans better and stronger and more robust. We do offer training in your communities. Each of your communities has a public health response coordinator, and that individual works with emergency managers in your communities to make sure that we are prepared for the next event that comes our way. And there are exercises to ensure that those plans can be carried out as intended. So we do a lot of work in that area to make sure that we're prepared.
Any other questions from Public Health? Seeing none. Thank you much for being here, but don't go too far just in case. Other people to testify in the bill. Hospital Association. Not sure if you're ready to go next, but we're ready to have you. Morning, Josh. Welcome to Labor Health. The floor is yours.
Good morning, Mr. Chairman, members of the committee. Josh Hannes with the Wyoming Hospital Association. I'm going to focus my comments mostly on the repealer in 35-4-113. And you heard a little bit of the history today and on Friday about this specific section of statute. And I just wanted to back up a little further even and share something a former Senate chairman of this committee talked about once in a committee meeting several years ago about how the state public health officer received some of their authority. And so that came in the time of smallpox. And what the state decided at that time was that in an emergency where decisions need to be made quickly, they contemplated chaotic situations, they needed one place to make decisions and to act quickly to protect health and safety. I think that applies here in that if you have a public health emergency, first of all, let's be clear that that's what it is. This isn't any time. This is when something's going on that's threatening the health and safety of our state. And hopefully we never have to use it. But in these situations, when we need to act quickly, these statutes provide some sense of order and they provide process. And in absence of that, you have chaos. So what I would suggest is, and I would urge caution, that if we're going to remove this, let's look at our processes in totality and let's look at them in their real context. so that we can make good policy decisions. So with that, Mr. Chairman, I'll stand for any questions.
And as you've heard, there seems to be some disagreement between what we are hearing from one hospital in one jurisdiction and other hospitals, maybe here in my community. Any testimony on why that might be? I believe the Casper Hospital is owned under a different corporation than maybe the Cheyenne Hospital. Are they intrinsic policies to each hospital that is preventing the, I guess it's called an online portal, for being able to quickly access your child's medical records? From my understanding, you can always access your kid's medical records. It just takes a written request. The issue in this piece of legislation where it started was you couldn't quickly and easily do it without on the portal, whatever that exactly means. I'm not sure because I'm not in Casper. But any testimony on, is that correct, that it's just different systems have different policies and different IT requirements?
Mr. Chairman, so my understanding of how that works is that, I won't say all, but certainly most hospitals have an online portal where you can request records. That might not be possible based on whatever electronic health record that you're using and how you access it online. Certainly, you can access your health records and those of your child by making a request. The process for doing that may be different, but in most cases, you can go online, make a request, and receive your records.
Further questions for the Hospital Association? Seeing none, thank you much. Other people here to testify for, against, or on the bill? Youth Services, welcome. We don't get you much. Maybe in the interim this year. Floor is yours, if you'd introduce yourself.
Mr. Chair, excuse me, Mr. Chairman, my name is Bruce Berkland. I am the Executive Director for the Wyoming Youth Service Association. So our programs do crisis shelters and group home residential treatment, but also do prevention programs in outpatient services for kids with their families. And I don't believe any of our programs are doing tobacco cessation directly, but certainly kids bring it up and we make referrals to the public health programs in our communities. And I would just say that on any issue that comes up with a kid we're working with, we're always encouraging that that be discussed and done with parents and family. But we certainly have kids too that it's the case where they're not willing to do that. And when it comes to the tobacco cessation, I think our position is that it's, and it may be that the youth just has done this without their parents knowing, and by going to quit, their parents will find out, and then a problem they've been trying to avoid will come up. And hopefully that could be worked through. That'd be great, but I do believe there are cases where that would be difficult too. And I think the young person, there certainly would be cases where they just decide not to do the tobacco cessation then. And I think our overall goal is to have whatever kids we can to quit use of any tobacco would be priority. With that, I'd ask if you have a question.
Thanks. I'm just guessing most of your facilities don't have an online portal to look at treatment and plans, but parents just submit a records request for when their child's in one of your facilities.
Correct. We don't have any online portals, but are always open to meeting with parents and having them come in.
Other questions? Seeing none, thank you very much. Other people wish to testify in the bill? Primary care's here. Oh, I really was just acknowledging you were here, Jan, but you're coming up, even better. And we have 3 chairs. Ms. Cartwright, welcome.
Good morning, Mr. Chairman. I'm Jan Cartwright, representing the Wyoming Public Health Association. The Wyoming Public Health Association strongly opposes this bill because it takes a tool away that can help teens stop using tobacco. I was also asked to share that the American Cancer Society Cancer Action Network also opposes this bill. They just weren't able to be here today. Tobacco is an addictive product, and most kids don't realize that they will become addicted to tobacco in its many forms. So when they realize their mistake, they need help to quit. From a public health standpoint, Wyoming is losing tools, including surveys, to monitor teen tobacco use. Remember that the Tobacco Master Settlement pays the state of Wyoming millions of dollars every year to cover the cost of the harms of tobacco. Tobacco is not an innate product. Tobacco is also a gateway drug to other substances. So my question is, why are we not helping kids to stop using tobacco instead of turning them in? Thank you, Mr. Chairman.
Ms. Cartwright, I'm assuming when we say, and maybe this isn't the right question for you, but tobacco cessation could be vape, could be cigarettes, could be dip, could be anything, snus that has tobacco in it qualifies under this program, if you know?
Mr. Chairman, I'm not aware of the newest cessation programs. I'd have to yield to the Department of Health, but I would assume addiction is addiction, so the treatment would be the same.
Thanks. Other questions? Representative Hornock.
Chairman, could you please explain the Wyoming Public Health Association and what that is and what you do?
Sure. Mr. Chairman, the Wyoming Public Health Association is a group of people who have public health as their main focus. It includes epidemiologists, people who are trained in public health, and I am not one of those people, I'm just representing them, but they do take a very strong stand on issues that affect all of us.
Mr. Chairman, in that, among that group, then, I'm curious if you would agree or disagree that when it comes to any health items dealing with children, such as tobacco cessation, would it be more effective to stop the child from continuing on to, like you said, further drugs or something like that? But would it be more effective to have the parents' involvement across the board when it comes to those kind of addictive substances? I wonder if you've seen that it's more effective to have the parents involved than the parents being left out of the picture.
Ms. Cartwright.
Mr. Chairman, the only way that I can answer that is that, again, we're losing ground in terms of surveying teens to figure out what they think is important, what they're doing. Teens are practicing to be adults. And so I think that we have to give them as many tools as possible. So directly to your question, I've not seen specific peer-reviewed studies around that.
Okay. Anything else? Seeing none. Thank you, Ms. Cartwright. Other people to testify? Ma'am, come on down. Yeah. You'd think with 30 people in the room, people would be jumping up, but a lot of people just to watch. Welcome. If you'd introduce yourself and who you're with, if anyone, and the floor is yours. If you'd make sure that green light is on your mic. Yep, push the button where it says push.
Okay.
Perfect. Go ahead.
Chairman, Danae Stampley, I work at Cheyenne Children's Clinic. I'm here in Cheyenne, and I just wanted to clarify the portal thing. So at Cheyenne Regional or any of its clinics, when a parent or a guardian comes in, there is a printout that they get that has a code, like a PIN number, I guess, that I've done it myself, go in and then you sign up for your child, and that's how you get access to your child's chart. And so I don't know, I would assume Banner has the same sort of thing. But even other clinics that Cheyenne Eye Clinic, I have my own chart. So that's how that works for Cheyenne. And so if the parent doesn't sign up, they don't get access online. Obviously, they can still go get it if they want in paper or physically. So,
hey, can I ask you some questions, Doctor, while you're here? So to get, and I should just know, but I just don't, right? Birth control, if you're 16 or 17, do the parents have to know if you're prescribing that for their child?
I believe they don't, but it seems like, it seems to change off and on, who says yes, who says no, but I believe that is something that you do not have to tell the parents at that age.
And then HPV vaccine, is that something you do have to tell? Because it's a multiple, do you know if you have to get parental permission to give a minor
as far as I know,
HPV?
you have to get parental permission.
Okay. Those are questions I was thinking about, and Dr. Rose already sat, so when you were here, it was easy to ask. Anybody else? Representative Ward.
Thank you, Mr. Chairman. So how this was described to me is that parents took the proper steps to sign up to access their children's health records. When their child turned 12, they were sent an email that said, you can no longer access your child's online health records. So the parents did the thing to sign up to have access to their child's health care records, and then were denied when the child turned 12. I was wondering if you could speak to that.
I can't.
Again, Dr. Stemple,
Because
that was in Casper, I
Yeah,
believe, at
it's,
Banner.
I don't know if that's their own policy. I don't know anything. Like when my kids turned 18, I went to my portal, and that day when I realized, oh, they're gone. I no longer have access to them. So yeah, that's how ours works. And I did want to make a comment kind of related to the, like, should parents know, and this is slightly unrelated, but I have had kids in the past, females, that, for instance, find out they're pregnant, and the crying, the sobbing, the please, 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 please don't tell my parents. They will murder me, they will kill me, those kind of things. And so I haven't had that with a smoking conversation, but there are kids out there that literally fear their parents when they find out something that they've done wrong.
Okay. Thank you very much. Stopping by this morning. Other public comment on the bill, for, against, or testimony? Nurses are here, I see. Other hospitals are here. Everyone's just listening. Anything else from public health? A public health officer? Okay. Anybody online? Seeing none. Last call for public comment. Any of the fun people coming to watch today want to talk about youth cessation programs? We have 4 or 5 youth in the room. Just here to watch. All right, seeing no further public comment, we will close public comment committee. What's your pleasure on House Bill 44? Moved by Representative Ward, seconded by Representative Penn. It's a suggested amendment from the go. Go ahead, Representative Ward.
Thank you, Mr. Chairman. So the second part of the repealer, which repeals 35-4-113BI, instead of repealing it, put it back in and instead remove only the vaccination language. So in section B, it would say during a public health emergency, the state health officer may subject a person to delete vaccination. So it would say to a person to medical treatment without consent in the following circumstances. Then in paragraph I, delete and the vaccination of, and then in II, delete and the vaccination of. So the idea here is that children could still be treated in a public health emergency, but they cannot be vaccinated. Vaccines take at least some time to become effective, and vaccines don't work with chemical agents, just to clarify that. So there should be not a reason why children have to be vaccinated during a public health emergency. There's certainly time to find the person responsible who can answer for that child. So that's my proposed amendment.
Is there a second? Seconded by Penn. Let me ask one question. So members of the audience and people watching online, it's a very simple one-page bill. We've been provided those actual repealers in front of us, which you're certainly welcome to go look up. But those of you following at home, why you don't see the language is because we have a separate printout. On that, Representative Ward in 35-4-113, that Romanet 2 is on behalf of an incompetent person. So that would be a legal adult, but who's been declared incompetent, has a guardianship, any number of things. I'm just making sure if that's along the same lines, if you can't find who their caregiver is at the time, should they be vaccinated or not? Is that?
Thank you, Mr. Chairman. Thank you for clarifying that. I believe the initial repealer only repealed 35-4-113BI. So I do not mean to include that in my amendment, the double I.
Got that, Barb? It's just an I. Discussion. All right, give me a dot. I have a couple doctors in the room. I just want to throw questions at one of you. Dr. Stampley, can I borrow you? Thanks. This is why you don't just randomly show up to legislative committee hearings. And that's why everybody else sits in the back. So my bird is going to go through situational. Rattlesnake bite. Is there that's an antidote? Is that a vaccine? If you have a child carried in, they're with a friend, get bit, can you, yeah.
Get
Would
an
you consider that a
antidote.
vaccine? That's an antidote, not a
Antidote.
vaccine. Okay. Tetanus or pertussis, is that the other cool name for it? Child gets brought in, spending the weekend with another family, steps on a nail, they come in. Is tetanus a vaccine?
Yes.
Yep, sure. Go ahead, Representative Trujillo.
What is the thank you, Mr. Chair. What is the rotation of a tetanus shot? Starts out with the vaccine at the beginning when they're babies, right? And then it's at every 10 year. So if a 7-year-old were to be in a state of emergency, wouldn't they already have the tetanus shot?
Yes.
Vaccine, thank you.
At age 5-ish.
Sure, Representative Yin.
Mr. Chairman, the question on the situation brought from Dr. Rose about rabies. Rabies is a vaccine, is that correct? Mr. Chairman.
Let's get a couple doctors up here.
What is the, how fast do you need to get a rabies shot before you have negative effects from not receiving a rabies shot?
Dr. Rose.
I thought I could help. Thanks. Chairman and Representative, good question. The research that I did just last night, because this isn't something we run into a ton, usually the symptoms onset is like 4 days later. However, the sooner you get the vaccine in, the better, as it's been proven over and over. And vaccines, as was stated earlier, do take a little while. You know, what a vaccine is, right? It's a either inactivated or weakened form of the pathogen that then, or the of the illness, the disease causing agent that then triggers in a response in your body. So it is actually working, you know, soon after it's been given. It just takes a while to be able to get to, for instance, the measures that we use in medicine are antibody levels and things like that, that we, or basically, there's a lot of different ways to measure vaccine effectiveness, but one of them is to draw levels, and those timing, the timing that a lot of people are referencing is like a 2-week period, I think it was what was stated during the last meeting. But there's a lot of evidence that it happens a lot sooner, and rabies is a great instance or a great example of that, because the sooner you get it in, the survival rate is a lot higher based on, like, even if you delay a day, there's differences in outcomes.
Okay. Representative Penn.
Thank you, Mr. Chairman. I just wanted to say, committee, that I think we're getting into the weeds here. The statute we're talking about is a public health emergency.
Exactly.
When we're talking about rabies, the likelihood of that occurring in a public health emergency is quite slim. The other thing about rabies, and I prescribe rabies prophylaxis treatment, post-exposure treatment more than once, is oftentimes it is not the only choice. Oftentimes we wait and watch because we have the dog in question, we put it in quarantine, we do those things. And so I think this discussion is a non-issue. We're talking about public health emergencies here. And so I just would add some caution there.
Okay.
So, Mr. Chairman, thank you.
Are we past questions for witnesses again?
Sure.
All right. I mean, you're welcome to stay up there, but if you hate the hot seat, I understand as well. Thank you very much. Go ahead, Representative.
Mr. Chairman, I think the discussion of rabies is relevant just because there are viruses that you would want quick treatment for. And even though rabies wouldn't be one where it would make sense in a public health emergency, that doesn't mean there wouldn't be viruses during a public health emergency that you wouldn't want a quick response for treatment of that viral agent.
Did our public health officer leave and I missed it?
He's right in front.
You're right there. Hi, I've been looking for you in the back. You jumped. You just knew I was going to call on you. Welcome, Dr. Hurst. So, I mean, as a state public health officer, you go to a lot of national conventions. You go through all these response plans. Are there, in your mind, things that would require mass vaccination quickly? And maybe you could talk about what a public health emergency is, how it's declared, how quickly it can happen. Yeah, in about a minute or two. We're still on an amendment, but if you could.
Thank you, Mr. Chairman, members of the committee. My name is Dr. Allie Harris. I'm the State Health Officer at the Wyoming Department of Health. Sure, to start out what a public health emergency is, it is something declared by the governor. He can declare it, whenever he would like to without a delay. And what's necessary is the occurrence or imminent threat of an illness or health condition caused by an epidemic or pandemic disease, a novel and highly fatal infectious agent or biological toxin that poses a substantial risk of a significant number of human fatalities or incidents of permanent or long-term disability. As far as I am aware, the COVID-19 pandemic is the only time that a public health emergency has been declared in Wyoming. So this is not a common event. But in planning for potential public health emergencies, as Stephanie mentioned before, we certainly do think of what agents that we might be up against. So with looking at our Category A bioterrorism agents are a couple of viruses, smallpox and the viral hemorrhagic fevers, which have been mentioned. There is no antibiotic post-exposure prophylaxis for that. Smallpox vaccine can be used as post-exposure prophylaxis if given within 2 to 3 days of exposure, can prevent or significantly lessen the severity of disease if given within a week. Likely you'll still get smallpox, but will lessen the severity of that. Smallpox is a disease, the most common form had a 30% case fatality rate. There are some forms that are over 95% case fatality rate. So Ebola is a viral hemorrhagic fever. There is a vaccine for that, FDA approved for 12 months and over. There's no specific antibiotics or other treatment. So when we are planning for public health emergencies, we do think of a couple viruses for which vaccination would be the primary way of preventing, as the statute says, disease, death, disability, and suffering.
Have any other states had state-level public health emergencies where they've had to do a vaccination event in the last 10 years?
Mr. Chairman, I am not aware. Again, I think the bill was drafted very well. I think the intent is a catastrophic event in which parents are not accessible because they have deceased or are themselves critically ill. And we hope it never happens. But I think the planning for what's potentially possible and wanting to know that we can protect kids if we need to is the purpose.
Thank you, Mr. Chairman. Do you believe that COVID-19 was a catastrophic event?
Mr. Chairman, Representative Ward, it was a pandemic that killed many people, including thousands of people in Wyoming. And now we have effective tools against it. However, it was not a situation in which, thankfully, a catastrophic situation in which parents were dying to the point where children were left without care. I worked as a fellow in West Africa during the Ebola outbreak there almost 10 years ago, and that situation did occur there. And it was terrible. And I think if the vaccine were around, that would have been something that parents would have wanted for their children. But thank goodness that was not the case here for COVID in Wyoming. We never crossed our minds to use this statute during the COVID pandemic.
Representative Hornock.
Chairman, so you said that COVID was the only time we've had an emergency situation where this was tested. Was there any specific time, and that was a 2-year event, was there any specific time where there was a situation where the parents could not be contacted and the child had to be vaccinated without the consent of the parents?
Dr. Harris.
Mr. Chairman, Representative Hornock, not that I'm aware. At least, from the Department of Health standpoint, we were never involved in such a situation.
All right. Thanks for jumping up there and answering the questions. We're still on the amendment on whether to delete "and the vaccination of" in Roman I. Further discussion. Representative Ward.
Thank you, Mr. Chairman. I just want to clarify on this amendment that in order to make the deleting of the "and the vaccination of" in Roman I work, you also have to remove "to vaccination" in B. Else, it negates, then if you take out "and the vaccination of" in Roman I, it doesn't make sense with B, because this is BI, yeah? So to clarify, you need to remove to vaccination under B as well as and the vaccination of under Romanet I. That's what my
I think
amendment
that
is.
makes sense, yes. But then it would stay still in Romanet 2, or it does get a little tricky how, I guess it would still work. You take out to vaccination or in B, and then in Romanet I, take out and the vaccination of.
Yeah.
It still works. All right, further discussion. I need to ask another dumb question, maybe to Representative Penn. Is a vaccination considered medical treatment? So if we take out the words and you read the statute in 10 years, the state health officer may subject a person to medical treatment without consent just by not having the word vaccination. Would you still, medical community, say that that's medical treatment?
A vaccination is different than a treatment. Until COVID, we had vaccinations that were intended to prevent a person from getting a disease. And once we came out with this so-called vaccination for COVID, and it was then found that it didn't prevent people from getting disease, then the narrative was changed to say that we're just going to prevent people from having severe disease. And it became a treatment. And so they are not the same thing.
Further discussion on the amendment? All those in favor of the amendment, say aye. Aye. Opposed, say no.
No.
That amendment is passed. Further amendments or discussion on the bill, committee?
Question on the bill.
Seeing no further discussion, Representative Hornock, go ahead.
Just some, I guess, discussion on the bill, some things that I noted during the conversation. And first of all, Mr. Chairman, I'd like to thank you for allowing us the time to debate this bill, because it does have implications to many people. And during the interim conversation, it went pretty quick. So, you know, doing this today and a carryover from our last meeting, and that's really much appreciated. So thank you for that. So just a couple of notes. I do want to make sure everybody understands that we're not against a tobacco cessation program by voting in favor of this bill. The good tobacco cessation program will continue and is funded through the Department of Health. So that will continue as it always has been. And then secondly, I find it kind of interesting that we have dealt with a recent, what's been termed a public health emergency. And in that time, there's not one specific example where this would have come into play. However, we do have specific examples, and the reason for the bill is because of some specific examples where this statute, I think, has been understood a little too broadly, and it has kept parents away from the medical records of their children. So I really don't think, and especially with the amendment that we just passed, I really think that the understanding is that we're not against treating children with things. We are definitely in favor of children getting the absolute best medical treatment that we can possibly find for them. But I think it does make a statement that we also say that to have parental involvement in that treatment is absolutely necessary. And I would go as far to say that parental involvement in that treatment also enhances and helps whatever treatment that we are trying to give these children as well. There's another layer of help to these children when we involve the parents. So anyway, that's that's why I'm voting in favor of this bill. Thanks.
Thank you. Any further testimony? Representative Ward?
Just a few sentences. I just wanted to say that it is my understanding, and I believe it should be everyone's understanding, that parents are the primary stakeholders and caretakers of their children's health. And we need to respect the right of parents and not put roadblocks in front of parents exercising their rights. And there are no public health records except during abuse, which should be hidden from parents. And I am very much in favor of this bill, and I hope that my fellow committee members will see it the same way.
Further discussion, Representative Penn.
Thank you, Mr. Chairman. I echo many of the comments of my colleagues. I think that we have some disconnect in here. In one situation, we're saying that we have to keep this secret from parents because the kid might get abused if they find out, and yet we're still going to send them a bill, which potentially creates a more dangerous situation. So a parent doesn't know that this child is having these types of treatments, and then they get a bill for $200 or $500 or however many treatments, and depending on what happens. And then that child is out of the potential watchful care of their provider. And so I think that removing this helps bring parents into the picture quickly, and then we can have those discussions. I think that any pathway that puts a barrier in front of parents as far as their involvement in a child's health needs to be very closely scrutinized. The title of this is Parental Rights in Minor Child's Health Care. Parents have all the rights in minor child's health care. If there are difficulties within a relationship in a home, we have legal means to pursue those things, and that needs to be done. As was testified, there's a duty to report if there's suspicion of abuse. And so this puts parents in the driver's seat of what decisions will be made for their children.
Representative Clouston.
Thank you, Mr. Chairman. I couldn't agree more that parents need to be involved in the care of their children and have access to those records. What I am hearing here is, when I checked with my local community, doesn't seem to be an issue, and we're not hearing an issue in Cheyenne. So I always believe in local control, and if this is more of an isolated incident, I don't want to set a law for the whole state. I'm also worried from hearing from the experts that this maybe has some consequences in a public health emergency that we haven't really contemplated in this bill, and I think this bill needs some more work and some more safety put on it so we don't do more harm than good.
Representative Trujillo.
Thank you, Mr. Chair. I'm looking at this on a whole different angle. So we have a lot of push for mobile units in putting mental health and health in schools, and doing this for the convenience of parents so they don't have to leave work and they can do all this via phone and computers. So my thing is we're doing all this for easy access for parents and kids to receive medical help. But while mom is sitting at the office, and yeah, maybe this is just one, and we hear that this isn't a problem in Wyoming with a bunch of things, and there's always a big problem in Wyoming. How do we explain, because just because it's one instance now, could be multiple instances in 2 years. Now we're going to have this parent have to drive down to the doctor's office or the hospital to access their electronic medical records. That's a possibility that could happen by keeping this statute in here. So I'd like people to think about that angle as well. And that's probably why that's why I'm voting for this.
Any further testimony? See, Representative O'Hearn.
Thank you, Mr. Chairman. With that angle, parenting is never easy. Parents need to spend more time with their kids. We have heard from some professionals that some parents aren't as involved with their students and their children as they should be. And I agree with Representative Clouston. I don't want to put a barrier between that, but I know there's parents that need to have some more skills than they actually have.
Any other discussion? Seeing none. Barb, if you'd call the roll on House Bill 44.
Representative Chadwick?
No.
Representative Clouston?
No.
Representative Hornock?
Aye.
Representative O'Hearn?
No.
Representative Penn?
Aye.
Representative Trujillo?
Aye.
Representative Ward,
Aye.
Representative Yin,
No.
Chairman Zwanitzer. 5 no, 4 aye.
All right, committee. I'm just guessing we'll have this conversation interim now as well. On Wednesday, a couple things coming up. It is the governor's prayer breakfast that morning. I know 3 of us are going. Can I see a show of hands if you're planning on going to the governor's prayer breakfast Wednesday? Okay. Historically, we always schedule the meeting for like 8, but nobody ever gets back until about 9. So probably 9 o'clock we'll start Wednesday. We do have 2 bills, one on the autism bill and one on the renaming of that account. We might only have 1 hour. I think the account rename bill I think there will be a lot of people here to testify. I will be shocked if any of you vote no. But if any of you are thinking about voting no on not changing that name, let me know. So we might make people unhappy just because we need to get through it real quick. And I think we have 5 or 6 people to testify on the autism bill as well. Trying to get at her by 10. If that doesn't work, we will probably go to lunch. It's also 3rd reading of the budget amendments. So big compressed day. Just know it's going to be quick. So if you have any questions on the autism bill, check with the sponsors. But just know that we'll start 9 o'clock on Wednesday morning. With that, we do start at 9:30 on the floor, and we are up to 80 budget amendments so far. Representative Ward seems to be very active with the University of Wyoming. I haven't read them yet, but lots from this committee. You guys were busy over the weekend, apparently. With that, we will see you all at 9 a.m. 9 a.m. here Wednesday morning. See you on the floor at 9:30.